So this is what makes anger a unique emotion. Anger is considered by many to be a secondary emotion. So thanks to Pixar's Inside Out, a lot of us are familiar with primary emotions. So sadness, joy, disgust, and fear. And no discredit to Inside Out, but it doesn't exactly capture the nuance of anger as a secondary emotion. What makes it different is that it comes out in response to another emotion. So, one question to kind of ask yourself is when you're feeling angry, what might be beneath this? What might my anger be responding to or protecting me from? And that insight can really mean the difference between villainizing someone who is angry versus finding compassion for someone who's terrified. Anger is not necessarily a bad thing. Actually, I tell my clients I get kind of like a nerd about anger. It's my favorite emotion. I'm obsessed with anger. There's really no good or bad emotions. We're human, and emotions serve an evolutionary function, just like parts of our body or more tangible or visible behavior. It all is there for a reason to help us survive. So anger, for example, it forms part of our instinct towards, fight or flight. It helps us fight off threats, protect us from danger, compete for resources, and ultimately to survive at the end of the day. So in modern times, when threats to our survival might not seem as obvious, when it's like a job interview instead of a saber-toothed tiger, we need to recognize that anger at the end of the day is still looking out for us, even if that threat might look different or when we're not exactly sure what we are responding to with anger. Anger indicates that you're human. And my favorite reframe for anger is that it's a response to an unmet need, if not several. So you're allowed to feel angry. I'm not one to invalidate anyone's emotions. It's literally in my job description. But if your anger expresses itself through violence, either physical or verbal, just remember that if it's harmful to others, it's harming yourself as well, because humans need healthy connections to survive. And I think what people a lot of the times don't recognize is that anger can also indicate shame or isolation. Several clients who struggle with anger gets a bad rap. But oftentimes those people are struggling with isolation, feeling powerless and misunderstood, and ultimately feeling ashamed for how they show up in the world. And so we often don't see that side of them because we're kind of too distracted by the, like, for lack of a better word, like bared teeth. There are so many strategies for managing anger, and I think sometimes we have to find the right tools for each person. But oftentimes, like basic anger management will start with kind of knowing your triggers, expanding your emotional vocabulary around what you're feeling. And then, because I take a more somatic or body-based approach, learning how to track how anger shows up in your body so that you can regulate your nervous system and better identify what those needs are. So, anger indicating unmet needs, learning to articulate what those needs are, and then learning how to meet those needs in the moment. So, one thing that I often tell clients is try to befriend your anger and greet it like a friend. Ask how it's doing, ask what's it's upsetting them, and ask what they need. Because if you don't express curiosity towards your anger, if you're expressing judgment towards your anger, then you're fighting battles on all fronts. You're fighting an internal battle with yourself and what you're feeling, and you're fighting a more, overt battle externally with everyone else. So befriend your anger. Anger might be pointing to something that's more profound when honestly, like, this might be an oversimplified way of looking at things, but the same principles apply to when depression or anxiety is pointing to something more profound. Ask yourself, when you feel a big emotion, do you feel stuck? Do you feel out of control? Does it hang around even when the stressor is gone? Does it impede your ability to fulfill your roles and responsibilities in everyday life? Does it drive disconnection in your relationship with yourself and your relationships with others? And if the answer is yes to any or all of those questions, then anger might be pointing to something more than just kind of a fleeting feeling or a transitory, experience of emotion. It might be pointing to something deeper, like a deeper wound that might need healing. Well, first of all, therapy is for everyone. Anger management therapy can also be for everyone. I often say one of my specialties is angry men, which you might not guess by looking at me, but it's kind of one of those specialties that found me. I often work in the intersections between anger and trauma, anger and substance abuse, anger and relationships. And so if you're finding yourself stuck in any of those traps, anger management therapy specifically could be helpful for you if you find the right person. Some of the approaches used in anger management therapy, I think sometimes focus more on behavior than anything else. And it makes sense. Anger can manifest in violent and overt and aggressive behavior that gets in our own way. So things like cognitive behavioral therapy, dialectical behavioral therapy, these theories can legitimately help and offer concrete tools to help manage anger. They're evidence-based treatments because they produce outcomes that are measurable. However, I think what sometimes gets missed in anger management is the origin of the anger, the origin behind the behaviors. So the work of connecting the dots and understanding why you're running into the same wall over and over again. And that's more than just focusing on the fixing. And I think it's because often where there's chronic anger issues, there's often also trauma. And trauma isn't going to heal by, just focusing on your thoughts and doing thought records. Trauma is a disconnection between the mind and the body, and healing from it requires rebuilding safety with others and fortifying new connections within yourself. So personally, I take a more relationship-centered approach that's not just behavioral, but also trauma-informed, family systems, and attachment-based. And that's kind of how I approach anger management therapy. But I think that there's, not a one-size-fits-all approach to any type of therapy.